Martucci.
And I'm Lauryne Davis.
And this is our knee eval video.
Before we start, do I have your permission to touch your knee and leg throughout this video?
Yes, and do I have yours? Alright, first we're going to start with bony palpations. So the first one on the list is tibial tuberosity, which is located, it's the bump right in the front of the knee, right below the knee right here.
Next I will be palpating her patella, which is right here.
Alright, the next thing we have is the femoral epicondyle, which is located right here.
Next I'll be palpating the head of her fibula, which is right here.
Moving on to fracture testing, we have the hang or sag test. To do this one, I'm just going to lift up her feet and check to see if her tibia is drooping.
Okay, next we'll be doing soft tissue palpations, and I'm going to start with the medial collateral ligament. It originates on the abductor tubercle, and then there's two portions of it, the deep part and the superficial, and the superficial goes to the pes anseridium while the deep goes to the medial meniscus. So you're going to find the joint space and then the connection here. I am palpating the MCL.
Alright, the next soft tissue palpation we're doing is the lateral collateral ligament, or the LCL. If you have the patient cross their foot over like this, it's a little bit easier. The LCL origin is the femoral epicondyle, and it inserts into the proximal aspect of the fibular head. So it's just right along here. Okay, moving on to cartilage, we first have the medial meniscus. So the medial meniscus is located medially and is right here.
Next we have the lateral meniscus, so we're going to find this. Same way as we did the other one, we're going to find where your two bones meet and then palpate at that line.
Okay, so moving on to the muscles, we have the quadricep group, which is responsible for the knee extension. It includes four muscles, which are the vastus medialis, the vastus lateralis, and the vastus intermedius, and the rectus femoris. So the vastus medialis is located medial, right here, palpating it right there. Its origin is the medial linea aspera for the longest portion, and for the oblique portion, the origin is the tendons from the abductor longus. Now, for all of these muscles, they have the same insertion, innervation, and root. So for their insertion, it's tibial tubercle via the patella and patellar ligaments. The innervation is the femoral nerve, and the root is L2, L3, and L4. Moving on to the next muscle within the group is the vastus lateralis. So that is on the lateral side, right here. And its origin is the greater trochanter. The vastus intermedius is located deep of the rectus femoris, so you can't really palpate it, but it's under here. And that is, its origin is the lower half of the linea aspera. And then the last one is the rectus femoris, which is sitting on top right here, over top of the vastus intermedius, and its origin is the anterior muscle testing. We're first going to demonstrate the muscle testing for the quadriceps. So first she's going to actively lift her foot and extend her knee by herself. Good, she's got that range of motion. She's going to relax. Then I'm going to place my hands down here and stabilize her, and we're going to go through that motion. I'm just applying a little bit of resistance. Good, she can still go all the way through. And then we're going to perform a break test. I'm going to put extend her knee into this position, and then she's just gonna not let me push down for 5 seconds. 1, 2, 3, 4, 5. So a positive for that test would be a patient being incapable of holding that resistance.
Next we'll be looking at the hamstrings, which their action is flexion of the knee. There are three muscles that make them up: the bicep femoris, the semimembranosus, and the semitendinosus. The bicep femoris has two heads, the long head and the short head. The long head's origin is at the ischial tuberosity, and the short head is at the lateral lip of the linea aspera. The insertion is the lateral tibial condyle, and the long head is innervated by the tibial nerve and the short head by the common peroneum. The nerve root for the long head is S1, S2, and S3, and then the short head is L5, S1, and S2. Then the bicep femoris is like here and comes out. Then next we'll look at the semimembranosus, which origin is the ischial tuberosity again, and the insertion is the posterior medial portion of the tibial's medial condyle. The innervation is the tibial nerve, and the root is L5, and S1. This one comes out here a little more and comes in here. And then the last one, the semitendinosus, its origin is also the ischial tuberosity, but its insertion is the medial portion of the tibial flare. It's innervated by the tibial nerve, and the root is L5, S1, and S2. And this one comes down here and once again comes back to the medial side of it. Next we'll do muscle testing for the hamstrings. To do this, first I'm just going to ask my patient to bend their knee up towards their butt, and she can do that, so that's good. And now we're going to do it with resistance. So I'm going to have her do the same thing, and I'm just going to add some resistance. Ready, go. Perfect. And then I'll do the brake test. So I'm going to put her about here, and I'm going to make sure that I'm stable, and I'm just going to have her do the same thing, and for 5 seconds. 1, 2, 3, 4, 5. And because she was able to do all of that, then her hamstrings are working properly. Next, I will be palpating the pezza and serine, which is duck foot in Latin. It's where the 3 tendons meet, the sartorius, gracilis, and the semitendinosus. And it's right over here.
Alright, moving on, we have the iliotibial band, or more commonly known as the IT band. Its origin is the anterior superior iliac crest, and its insertion is Gerdy's tubercle. So that just is right on the outside of the knee, all the way down.
Next, we'll be looking at the patella bursas. There are 2 of them. The suprapatellar bursa, which sits above the patella here, and the infrapatellar bursa, which would be right about down there.
Alright, moving on to ligamentous testing, we're going to start with the valgus test, stress test, which is for the MCL. So first I'm going to put her knee in about 10 degrees, right there. I'm going to stabilize right above her ankle and right below her tibial tuberosity, and then just shear back and forth looking for an end point. Okay, a positive test would be no end point there. Then we're going to do the same thing but at about 25 degrees, just back and forth. And there's an end point, so the test is negative.
Now we're going to do ligament testing with a varus load, which tests the LCL. So I'm going to have her lay back. And I'm going to put my hand on her ankle here. I'm going to use her tibial tuberosity. I'm going to put it in about a 10-degree bend here. And then I'm going to use my body. I'm going to pull out with my ankle and push in, or at her ankle and push in at the knee, looking for the end point here. And I feel it, so her LCL is intact.
Test, which is for the ACL. I'm first going to take my proximal hand and put it on the femur, and then the distal hand on the tibia. I'm going to put her knee into about 10 to 20 degrees of flexion, and then I'm going to push down on the femur and up on the tibia. And I can feel that end point, which means there's a negative test.
Next, we're going to do the anterior drawer test to test the ACL. To do this, I'm going to have her lay back and have her leg at a 90-degree angle here. I am going to put my fingers here. I have them on the tibial flare, tibial tuberosity, and I'll sit here and I will pull out and looking for the end point, and I feel it here. To do the schlokums, I'm going to have her rotate her foot in, and I'm going to do the same thing here. And I feel that, and then I'm just going to have her twist her foot the other direction, and I will do the same thing once again. The schlokums tests for the individual parts of the ACL.
Okay, next we're going to do posterior drawer, which is really similar. I'm going to sit on her foot the same way she did to mine, place my hands in the same position, but I am pushing in towards her this time. Feeling that end.
Now we're going to do the Godfrey's test, and this looks at the PCL. To do this, I'm going to have her bend her legs at 90 degrees, and I'm going to hold them up. And I am here looking to see if the tibia droops or if there's any difference in a bilateral examination. And there isn't, so she's good.
Alright, the next test we're going to do is called the Lunar's test. It's really similar to the last one. Her knees are going to be at a 90-degree angle. I'm going to lift them up from the bottom like this and externally rotate them. Okay? We are looking for if one foot is more externally rotated on one side or the other, and posterior lateral instability. That would be a positive test.
Next we'll be performing the McMurray's test, which is looking for a torn meniscus. So first we're going to do the medial side by finding the joint space and placing your finger over where the meniscus would be. I'm going to lift up her leg, and I'm going to make sure that I'm rotating it and bending it in different directions so I can feel it all. Now when I switch directions, I will be looking for like a clicking or a popping feeling here, and then I can also do it for the lateral side, which is the same thing, just on the opposite side. Oh, goodness. And because she doesn't have any clicking, popping, and it just feels like there's nothing going on in there, then it is a negative test.
Alright, the next test we're going to do is the Apley's test, which a positive would mean there's a meniscus tear. This isn't something I can feel as someone giving the exam, but this is something that she would feel pain or discomfort in. So I'm going to stabilize the ankle, place my other hand on top of her foot, and just press down right into the table. Any pain?
Nope.
So that's a negative test.
Next, I'll be performing the sweep test. This is looking for intracapsular swelling. To do this, I'm just going to come down here and then push with this where the swelling would be, up, and you should see the swelling move up into this region over here.
Alright, the next test we're going to do is the ballotable patella test. So basically, I'm just going to place my fingers on top of her kneecap and press down and lift back up. If there was swelling here, her kneecap would pop back up, but right now there's not really any movement, so that is a negative test.
Next, we'll be measuring her Q angle. The Q angle is important for men to be less than 13 degrees and women to be less than 18 degrees to allow for proper patella tracking. So to do this, we already have her tibial tuberosity marked, and so her patella will be where you put the center, and you're going to line the stable of her arm up with her femur at the bottom with the tuberosity there, and she is at 10 degrees, which is in normal range for a woman's Q angle.